Good morning, good afternoon, good evening. Depends on when you're watching my video. I'm still on the topic, the theology of mental illness. Yes, I know that most of you may not know me. I know some that have been accessing my video via YouTube have known me. But for you to know me more better, subscribe. Just click the red button and subscribe. The person, your brother, has done Wokike. I really want to still really more emphasis on the theology of mental illness. Yes, recently I told you that we have the two basic, attributes of mental illness. And the cause of mental illness is basically unknown, but you can attribute it to the following factor. One, you say it can be predisposing and precipitating. Now, I know we have done justice in the predisposing aspect of it. Now, I want to talk on the precipitating aspect of it. Precipitative aspect of aspects which causes mental illness, or you can call it the physical factors that causes mental illness, can be things like trauma from head injury, we have infection, we have typhoid fever, cerebral malaria, encephalitis, meningitis, HIV and AIDS, over or under secretion of thyroid glands. These are under physical cause of it. Because the precipitating factor is very into two basic branches. Let me just be sincere. One, we have the physical cause. Well, I'm listing the physical causes. We have things like lead poisoning. We have things like alcohol, brain tumor. Forced delivery can also cause it. Use of vacuum extraction, malnutrition, famine, war, landslide, anything, let me say chronic terminal illness, unwanted pregnancy, substance abuse, common monocyte poisoning, hormonal imbalance, side effect of medication, infertility. People that are not infertile or feel that they cannot have children can easily go depressed. So we have impotence also. So many things can lead to basic cause of mental illness. We still have the psychological causes or factors. Loss of loved ones, yes. Loss of wealth. Armed robbery attack. You see some persons that you will always remember when they were once robbed. You see that they can be able to feel that they have been affected, and this can lead to post-traumatic stress syndrome or post-traumatic stress disorder, PTSD. Then we have things like a foreign attack. Yes, divorce can also lead to mental illness. We still talk about disappointment. Yes, when you are not able to achieve what you're supposed to achieve, or someone disappointed you get to frustration, and frustration can also lead to depression. It can lead to so many things. Even stress will be increased, and that individual will not be repressed, behaviorally and otherwise, which is depression will start playing a role. We have unemployment. I've graduated from school, I don't have a job, and I'm not employed. How do you think I'm happy? This can easily give me some emotional problems, which is called psychological problem or challenges. We still have things like retrenchment. Some persons in a job they are working. All of a sudden they became retrenched. They list their name among the people that have been relieved of their job. Most people that do not have a good emotional well-being or what we call mental competency can easily go depressed. Even retirement. Some persons are afraid of going on retirement because there is a particular depression known as melancholic depression or transitional depression. This type of depression comes in place when somebody, let me say a teen, is passing through adolescent stage. There are processes of changes in the body that can lead that particular individual into depression. That again is when you're about retiring from job. It is a very painful thing to some persons. Some persons may not even, see retirement as a reality until when it becomes a reality. They will keep denying the retirement stage of their life. So some persons, that how they will perceive retirement, that can also lead to mental illness. We talk about failure in achievement. Imagine when you're supposed to achieve something, you are supposed to build house, you're supposed to buy car when you are doing well or when you are having money, but unable to achieve those things. My brother, it can go mentally ill. And this is also a psychological factor, a psychological causes of mental illness. Like fear of death. Some people are just I call it masticophobic. Yeah. Some persons fear death. They fear that they're going to die. Why will you fear death? Did you fear when you were born? You cried while you were born. Now you are thinking about death. Why will you first of all think about death? What is making you feel as if you want to die? Why? You should, even when you're getting age, you should be happy that you have reached a particular age in life. There's some persons that have low emotional competency can easily go depressed and start having a mental problem. We say poverty. Poverty is another problem. In fact, it's a mental illness of its own. Poverty is a challenge. Poverty is a mentality. Poverty is something that if you did not achieve, you did not become somebody, you become poor. They say those that are poor are those that tried and couldn't make it. We still have souls that have decided to be poor and who refuse to work, who refuse to be dependent. When you are poor, if not properly managed, you can have mental illness. I've seen some people that are poor, but because within their mind they are competent, they are not mentally ill. They will live well, just like some of us. We have things like rape. Yes, some children that have experienced rape can easily have problem with education, can easily have problem with attending to job, even responding to their significant other. They can easily have issues in their brain. They can easily have mental illness, and this mental illness that they're having is a mental illness that can lead to a problem that can cause to what will make them not to concentrate in any activity that they are doing. Most especially when they are children, they will always remember this at old age. When they get to a certain age, this can easily make them depressed. Yes, I've seen some bright students, some bright first class students that have had that just their mother told them history of how they were raped when they were 7 or 5 years. These people became depressed and they are now on drugs for depression. So mothers, I still advise you to curtail the information you give to your children. Father, please mind what you tell your children also. Then I want to go, I told you before that we have the applied courses of mental illness and theoretical courses. In terms of etiology of mental illness, I want to emphasize or give you more details of the theoretical perspective of mental illness etiology. Well, we have psychodynamic theory. What is this theory talk about? According to this theory, anxiety is usually dealt with repression. Whatever is being repressed is what you are feeling as if you want to go into realizing that this is bad, and that anxiety alone can make you go into repress, and the repressing days is what is making you to feel as if you are not having that anxiety, but because it is being repressed, when that repression fails to function adequately, other secondary defense mechanism will manifest. Ego mechanism come into action. In phobia, the secondary defense mechanism is displacement. Anxiety is transferred from one dangerous or frightening object to neutral object. Yeah, it's a good way of trying to cope with phobia or anxiety, but we are trying to tell you that how this transfer of this feeling without realizing that this is fake, without realizing that you are still in a denial stage, it can still cause you to break down. So make sure you understand this. I don't want to go into it again. Then we still have things like trying to have a problem with conversation. Symptoms allow a forbidden wish or urge, like those forbidden wish or urge to be, always be talked of, discussed about, because whenever this is being discussed, the individual have a mental, we remember something and start having challenges. That's in that aspect. I want to go into learning theory. Learning theory is some persons that that there is one of my proponents in psychology that I love most that gave a theory known as social learning theory. Originally it was called social learning theory, but he made it to be learned to become a learning theory. He said according to classical conditioning, a stressful stimulus produces an unconditional response that is fear. When the stressful stimulus is repeatedly paired with a harmless object, then the stressful stimulus is what? Now harmless. And because it is not a harmless object, can now stand alone and produce the fear, which is now a conditional response. Remember, this is not talking about Bandura, who is the proponent of social and theory. I'll talk about that in asking that. Then they don't talk about Ivan Pavlov, who, in fact, even Watson, John Watson tried to pair a boy, a child that is with rats. When this child sees rats, the child will play with the rat. At the point, your Watson will now make this rat, whenever the rat is coming, will now shout, and the child will now become afraid. At the point, it becomes let me say internalized to the individual that whenever this rat comes out, this individual, this child will start crying. It is a practical done in a psychological laboratory. What about that of the baby dog, the bubble dog? Bubble dog is trying to talk about how an individual can learn aggressive tendency. Somebody trying to pull out aggression. That's why I used to tell people that the majority of those that experience or have parents that usually abuse their mother or that abuse people or that are aggressive will automatically or might be aggressive because it is learnable. Let me go to that my proponent about my Bandura. Bandura talk about things like social and theory, then talk things like that what called vicarious learning. Yes, we talk about vicarious learning, that is learning from someone's manifestation, how someone's behavior, is being affected. Okay, the effect of a particular behavior to a particular individual, then you learn and refusing that particular behavior to occur in you. That means you're not part of the effect of that behavior, either normally or abnormal. Then, but you can easily learn that this particular behavior is good or bad from this vigorous learning. Also say we have what we call learning by imitation, modeling and identification. It's just trying to tell you that you can learn from what you see and what you observe. And when you observe this particular thing that is good, if it is reinforcing, if the person that is doing it is somebody you want to model, automatically you start acting, behaving, trying to imitate that particular person, and automatically you have learned. And the learning theory also play a role. We have so many people that have made a lot of emphasis in learning theory. What about the theory? But I don't want to go more. Let me start with these two aspects in learning. Let's go to cognitive theory. Yes, they said in cognitive theory, anxiety is the product of faulty cognition. Remember that when there is a bad thought, first of all, if that thought is not solved, anxiety sets in, whether you like it or not. Then, when the obsession is being carried out, which is called compulsion, there's a relief of anxiety. And now, in cognitive theory, the theory believes that some individuals engage in negative and irrational thinking that produce anxiety. Yeah, this anxiety reaction and phobia is what is being registered in that individual schema. That is a particular aspect of brain that is responsible in thinking, in cognition. Then the individual begins to seek out avoidance. If it is things that make him to be afraid, whenever you see that particular thing, you become irritated, that recognition have told you something, you leave that particular place. That's why in depression we have what we call the depression, have what we call the negative theories of cognition. Some persons call it the triad of depression, and how the individual see or try to have an expectation of the world, that is environment. When you see that there is negative expectation of the environment, you become depressed. Sometimes some people have that cognition that there is a negative expectation of self. I cannot help myself. I am now incapable. You can become depressed because have started having negative expectation of self. What about negative expectation of the future? Where there is hopelessness, pessimism will set in, anger will set in, tiredness. There will also be retardation in mental cognition. That individual will have a challenge because that's the cognition have been altered. That is how cognitive theory come into play as a cause of mental illness. What about biological or genetic theory? Yes, they say that genetic factor predisposes to more disorder, lifetime risk for children of one parent 29%, both parents 74%, monozygote twins 65%. Then we talk about dizygote twins, which is 15% have the possibility to develop what schizophrenia. And these people are among people that are born in a consequence, let me call it consequence marriage. Because when you are born in a consequence marriage, where your father and your mother is not the same, where there is a problem in the marriage, you see that you're having a consanguineous, instead of you to feel proud and feel otherwise, my brother, you will always be having another thoughts, and before you realize there will be split of mind. You now be having dual personality. There will be things like hallucination, delusion. Instead, you'll be looking for an alternative to weigh it off by going into addiction. Finally, you go into mental illness proper. We have things like biochemical theory. Yes, this is talking about the theory is really emphasizing on the, I call it biochemical substances or neurobiomes. These neurochemical biomes, they are chemical substances that make us to behave the way we behave, act the way we act, and feel the way we feel. Yes. If there is a depletion of dopamine in the motor area, let me talk about the muscles. My brother, the possibility of you developing Parkinson's disease is what that is very, very it's something that must come to play because your smooth your muscles. Let me talk about the skeletal muscle and the smooth muscle is being affected because these muscles that we are rotating, touching, as I'm shooting my hand, as I'm talking, rolling my mouth, is being controlled by dopamine. Then at the point again, this dopamine, epinephrine, another one again, serotonin, all these amines or catecholamines, when they have been depleted, not only in the muscle now, in the brain or in the nerve cell, that individual will start having symptoms of depression. Then what about in its excesses? You can also have what psychosis because there is excessive amount of these new biochemical substances. So this plays a role in depression because abnormal level of epinephrine, serotonin, can lead to this. Frankly speaking, when you have it in a low level, you can have depression. What about GABA? When GABA is not stable, my brother, the possibility of you, if you have a low GABA, you will always be what? An addict of what? A GABA enhancer. Then, or you will become and automatically become an introvert, which you may not become a depressive patient, but you will always be having excessive sleepiness. Okay, no, there will not be sleepiness, there will be sleeplessness because the GABA have been reduced. So this GABA need to be enhanced by sodium valproate or by diazepam or any of the GABA enhancers products. Then let's talk about things like prostaglandin and endorphin. Endorphin is a happy hormone. If it is not there, my brother, sadness continues. Prostaglandin, you know how it works. It's old. So all these things have a basic role that they play because they are all neurotransmitters, they are all biochemical substances, and that's how this theory is talking. The theory is talking and the theory is trying to emphasize that these neurotransmitters ought to be in a moderate amount. Behavior theory, another one. Behavior theory, they say that depression is conditioned by repeated loss in the past. Then symptoms are learned from the surrounding environment. Yes, you can let somebody being depressed, and if your mother is always crying, you can also learn how to cry, and you now start manifesting that behavior. It is common with what we call the polio aview. The polio aview is a particular mental illness where you are mentally sick as a husband and the wife, because of the love, will now follow you. And from there, you will now, introduce your children or all people that behave like the way you behave, you will now be having that symptom, call it follow adults. This follow adult is a mental illness that occur today in so many churches. Some people want to be like their pastor. Some people want to be like their daddy, their mommy in the church. Some people want to, I'm not talking to criticize a particular church, but this excessive imitation, identification of the behavior of another can also be, you know, modeling, in fact, can make you behave the way the person is behaving. That is behavioral theory in this aspect. We still have a behavioral theory of having a psychological relief by avoidance of stress. So because this particular thing give you stress, you avoid. Sometimes you can be having a behavioral challenges or problems with yourself because of a particular individual. You will not be avoiding that person. Why will you avoid that person? My brother, confront the person and ask the person why is it disturbing you. Some other psychological theory, some other theory again is psychoanalytical theory. This theory is talking about Freud's ideology in 1957, where he said that depression is due to loss of loved one and fixation in the oral phase of development. I just want to talk about how he places it in terms of the structure of the mind. He talk about the id, the ego, and superego. He said that whenever the ego is being overpowered by the id, the individual will become depressed. What do you understand by the id? Id is just like the reality aspect of an individual. Then, since it is the reality aspect, sorry, it is the it is the primitive aspect that are biological in nature, and since it is primitive and biological, it is always akin to short term consequences or gratification. Then another one again that play a role again is ego. Oh, super ego. Let me talk about super ego. Is just like Bible is just like the gods, it's just like the Lord of the law of the land, just like the Holy Spirit telling you not to do this. Let me tell you, within your mind, when you want to carry out an action, have two things, two people talking in your mind. Do, don't do, do, don't. This is bad. If you do this, this is the consequences. Then some people will now obey the other aid. Those people are people that act before thinking. Then those that think before acting are those that obey the other one, the super ego. Then the ego is in between them. The super ego is more of the conscious. It makes you to become morally oriented, but the ego is trying to make you to be what real. What are you is based on your ego. If your ego is being overpowered by super ego or it, my brother, you have the potential of going into depression. Let me tell you one thing. If the law, if you are an obedient of the law, my brother,